James Bell Associates, or JBA for short, and I'll be hosting today's event with assistance from my JBA colleagues Erin Morehouse and Julie Murphy. Before we begin, let me provide some required background information. Today's webinar was developed and is being hosted by JBA on behalf of the Children's Bureau, Administration for Children and Families, U.S. Department of Health and Human Services, under contract number 47QRAA20D0008. The opinions and ideas expressed in this webinar are those of the panelists and do not necessarily represent the official views, policies, or positions of the Children's Bureau, the Administration for Children and Families, or the U.S. Department of Health and Human Services. So let's begin with a little background about today's webinar. Stories are a powerful and persuasive method for conveying the real-life experiences and perspectives of individuals from diverse backgrounds, and they serve as an essential tool for planning, implementation, research, and evaluation in child welfare program settings. This webinar will provide an overview of Our Tomorrows, a project led by the Center for Public Partnerships and Research at the University of Kansas that collects family stories to gain insights into the experiences of families in Kansas and uses that understanding to take action and make decisions. It will also introduce participants to SenseMaker, a web-based software platform that facilitates the collection, analysis, and visualization of qualitative data. The panelists will describe how they use SenseMaker to assist with planning, assessment, and evaluation activities undertaken as part of child welfare discretionary grant projects funded through the Children's Bureau. With that context, let me introduce our webinar panelists. We are fortunate to be hearing from 5 child welfare researchers and practitioners who possess extensive practice and research-based experience with the Our Tomorrows project and SenseMaker. We'll first be hearing from Jenny Flinders. Jenny is a research project manager at the Center for Public Partnerships and Research at the University of Kansas. In her role at the center, she supports program implementation and evaluation for community-based participatory projects centered on community voice and choice. Specifically, she leads participatory narrative research initiatives with partner communities and organizations through the use of SenseMaker. Jenny is currently completing her PhD in educational leadership and policy with a focus on Indigenous education policy, historical trauma, and reconciliation in the education system. We'll next be hearing from Lexi Palacio, who serves as the Community Collaborative Director for the Partners in Prevention Initiative, a San Diego collaborative effort to increase family strengthening and support in an effort to prevent child abuse and neglect in San Diego County. Lexi has been in the field of early care and education for the past 20 years, serving in previous roles as regional lead for healthy development services at Rady Children's Hospital, preschool director for Magdalena Eck YMCA preschool and preschool teacher, administrator and preschool director for Bright Horizons. Lexi received her bachelor's in child and adolescent development and her master's in educational psychology with an emphasis in early childhood education from California State University, Northridge. Joining Lexi will be Ariane Porras, a native San Diegan who has served San Diego County for over a decade through her work with the YMCA of San Diego County. She has worked as an early childhood mental health consultant and trainer to promote socio-emotional literacy and developmental foundations. She has worked with kinship families, facilitating support groups and helping them navigate and access resources. In her current role as consultant and trainer with the Partners in Prevention Project, Ariane educates the public on primary prevention frameworks, trauma-informed care, and culturally responsive practices. Next, we'll be hearing from Erin Havig, a social worker with 25 years of experience working with children and families at multiple levels in Washington State. Erin is the primary and community prevention lead at the Washington State Department of Children, Youth, and Families, where she is part of a team that engages families and communities in building family strengthening and support efforts. Erin's team believes in the power of families to support their children and communities, and that by partnering and learning the stories of the communities and families, they can design better supportive services that recognize and build on family strengths. Joining Erin will be Dr. Joy Leal, who is a community prevention specialist from the Washington Department of Children, Youth, and Families. In this role, she coordinates the Strengthen Families Locally project, a federally funded pilot to provide community-driven child abuse prevention in 4 communities around Washington State. Joy also serves on the department's trauma-informed work group. And finally, we'll be hearing from Dr. Caleb Byers, who is an associate research professor at the University of Kansas School of Social Welfare. Her research and scholarship focuses on cross-systems and structural approaches to maltreatment prevention and the promotion of child and family well-being. She applies advanced analytic approaches and a translational prevention framework to family, organizational, and systems level issues that impact children in partnerships with community-based agencies. Kayla has served as a principal and co-principal investigator and lead evaluator on large-scale studies, including federal, state, and locally funded initiatives in child welfare, early childhood, pediatric, and mental health systems. Kayla currently serves as principal investigator of the statewide evaluation of the Family vs. Prevention Services Act and Universal Prevention for Strong and Thriving Families demonstration project, promoting evaluation and primary prevention in Kansas. Before our presentation begins, let me go over a couple of logistical issues. First, we'll be keeping everyone on mute during the entirety of this event. However, if you'd like to ask a question of one or more of our panelists, please use the Q&A feature in the taskbar at the bottom of your screen to type in your question, and I'll pose them to the panelists in the order they are received. Please also feel free to use the chat feature in the taskbar to share thoughts, reactions, resources, and ideas for other webinar participants. We'll also monitor the chat feature for questions to the panelists, but ask you to use the Q&A feature if possible. Today's event is scheduled to last 75 minutes, but we can go over that time depending on the number of questions we receive. Finally, please note that today's webinar is being recorded, so following this event, we'll provide an online link to the recording to all webinar participants that you can share with colleagues who were unable to attend. So without further delay, I will hand it over to Jenny.
All right, thanks, Elliot.
Thanks,
Can everyone
Jenny.
hear me? Yep, we're good. All right,
Yes.
Let's do it. Well, hello and welcome, everyone. Thanks so much for taking the time to spend this hour or so with us. As Elliot said, I'm Jenny Flinders. I'm a research project manager at the Center for Public Partnerships and Research. It's really great to be in this space with you all. I think we all acknowledge that there are a lot of things you could do with your time, so it's always special when you choose to spend it with us. I get to talk about one of my favorite things today, and that is how we elevate community voice and do some collective sense making using our tomorrows. My job here is to do some level setting for us, provide some background on what our tomorrows is, how we initiated it, and then talk a bit about our why as we continue to develop the tool and the approach with our partners together. I also wanted to say real quick, though, that it's really exciting for me, and I'm honored to be here with three of our dear partners and friends who are going to dig into different pieces of this approach and how they are actively using it currently right now. So I'm going to reserve a lot of details of those parts of the process for them, and we'll get to enjoy their presentations with you all. So let's get to it. Next slide. Okay, so when I said high level, I really meant it. We're going to start off here with a fairly wordy description of what this is, but at its core, at least in terms of where we started and how we got here, our Tomorrows is a novel framework for listening. And by that, I mean that, we're all frequently confronted with the need to approach community and family engagement in a more meaningful and actionable way. And so that, to me, and I think for all of us, is the need for a tool and an approach, which this is both, to listen and then to hear, right? The commitment to hear what folks are sharing with us. So it is the tool, the SenseMaker software system, and then the approach piece of it is everything else that goes on in terms of how we engage with that full cycle. So it starts, as it mentions here, with a very broad, inclusive approach to listening to community voices, and that's what we call our story bank. Currently in Kansas, we're really honored to be trusted with over 6,000 stories. In the story bank, in the sort of core project that started all of this for us in partnership with the Kansas Children's Cabinet and Trust Fund. But we are also committed to the so what of it all. So what about those 6,000 stories and all the stories since, and all of these other partner projects. And I think of that as really the personal and social responsibility that comes with this kind of work. So it's that practice of listening to and holding the shared experiences of others. So as you'll see here on the screen, the Our Tomorrow's approach is also about a lot of doing. And so after that story bank happens, after we've collected those lived experiences, it's also really critical that we take those shared stories and the patterns of lived experiences that they yield, and we take those back to the communities who trusted us with their voices, as well as directly to people with decision-making power. And that part of the process is what we call our sense-making phase, where we work collaboratively to keep probing what we're hearing, to question what it means, to think about what it means to different people in different circumstances, and to consider what we all need to do to help create more experiences like those from people who are thriving, and fewer experiences from those from people who are just surviving. And then this final piece that you'll see here, this very wordy screen, is that we follow through on those conversations with community action labs and various kinds of pilot projects. So the idea is that this whole process is meant to encourage rapid cycle, responsive idea generation from the ground up. And maybe most importantly, that we're ensuring that when those needs are identified and those ideas are generated, that there is a trusted, productive place for them to land and be sincerely activated. Okay, next slide. So I just mentioned the responsibility that I and I think all of us really feel from being entrusted with lived experiences. So to that end, I think it's important to share a few, I think of these almost as ground rules, but also I think strengths of why we use Our Tomorrows and what it can do, which you're going to see from everyone for the rest of the presentation. So most of us here work in the realm of child and family supports and strengthening, systems building. So you might be wondering, like, what exactly something like this would look like, or how it would help or work with your work. So the first thing you see here is that it can help establish a baseline of needs by setting a baseline of experiences. And our colleague Kayla Byers will talk a bit more about how that has looked in some of their work, but just sort of briefly, it can be this incredible tool that is essentially asking a community what a logic model or an implementation plan or an evaluation plan should look like before you build them, which is not to say that we're not, most often coming to the table, particularly with grant funded projects, with like some programmatic assumptions already on paper, but it's really an opportunity to pause and listen. And the next one is related, as I just said, and that's that it helps us challenge assumptions about what we think people need based on what they experience. So the previous point's really more about project planning, but it absolutely can be useful and important as a tool to check and challenge assumptions at any point of our work and with any group of people. And I think we can all agree that that's a really critical thing to do. And then building from that cyclical or continuous nature of the work, it's really great at providing real-time feedback on the things that we're doing, trying, seeing, offering as we're doing it. And if we commit to that, we can do this sort of rapid cycle improvement and facilitate those connections and new ideas as we grow together. So again, as I said, it's really about consistent commitment to not just listening, but to hearing and doing from what is shared. Next slide. All right. So one of the most important things about Our Tomorrows is that it is really a full process. It's not just a survey and it's not just a tool. We won't dig super deep into what exactly makes up an Our Tomorrows survey or process together today, but there are a couple of things here I really want to highlight that I think make it unique and different, and we'll explain a lot about how my friends coming up are really leveraging it and getting so much power out of it in the work that they're doing. So when when we were working on developing this tool at our center, we had that recognition that surveys and interviews, really traditional ones, often have us come to the table from the beginning with some assumptions, and we're asking questions that yield the answers we want, right? So this tool and this approach is really unique in that the first thing you see here is that the prompt, what you're asking for, is really broad. So you're not saying, tell me about how that thing I just offered you worked for you. You're saying, tell me about something that happened today, as an example. And that allows you to really scan for this breadth of experience and catch full context about that work. The other important thing, and then we'll just sort of jump ahead to an example and let you get ahead to our partner friends here, is that the self-coded patterns are so key. So when traditional qualitative research is done, and I'm a qualitative researcher, so it's no knock on that, but we are typically interviewing, doing focus groups, maybe even running surveys. And we take that data back, we take those stories back, and we read them, we code them, and we decide what is being said there and what the themes mean. In this tool, participants who share a story then get a series of questions about that experience that they just shared. So they end up coding it and making sense of it themselves in their own ways and in their own words. And we focus on those patterns. We don't go back in and add other meaning that wasn't provided to us from community members. So it's a really different way of thinking about how we use and elevate stories. Okay, next slide. I'm going to fly through this. So just as an example of how these question types work for yourself, just in your mind, maybe on a piece of paper, look at this triangle and think about, for yourself, this prompt is coming from your own first person. I usually trust information that comes from, and on this triangle, we have points: family, friends, social network, your own experiences or gut feelings, the news, agencies, and other experts. And so if we think about that, where you would put, if you had to put a dot somewhere on that triangle that represents sort of who you trust, who do you go to for trusted information? That is sort of the crux of the experience after sharing a story of how this tool can work. And then if we go to the next slide, here's a little example of how that comes back to us, what that looks like on the back end and how we start to help make sense of this. So you're seeing dots from other people, in this case, some community members who were responding to this question specifically about, these are people who are needing or trying to access childcare. And so we can start to see how these experiences cluster, make patterns of experience. And then when we go in, we can start to learn more things. And I've pulled just some very brief things here for you as an example. So for these folks who are trusting family, friends, and their social network more than anything else, grocery costs are really affecting them. Wait lists are a giant issue. The majority of them are accessing or using home-based care and not always licensed home-based care. And they represent this big variety of parenting circumstances, such as grandparents, teen parents, single parents, and parents of adopted children. And then from there, we can start to extract these stories. And this is the briefest of example of what that process looks like to, if you all were community members, decision makers in this particular community, and we would come back together, we would talk about this, we would read the story from some grandparents who really struggled to keep their children together, their grandchildren together in childcare situations, and they talk about the trauma that was for everybody to be separated. And we would start to ask questions. So how do we reach these people? What would our communication look like? What would we not want to say to them? How could we get them to trust some of our resources and expertise a little bit more? And that's sort of a very brief example of how this process would work. For time, I'm going to suggest we go ahead and skip past the next two slides, the last example that I pulled, but if we get to the last slide here, we really love to talk about this and would be happy to share more examples of what this looks like. And you're going to see a bunch of examples today. So please reach out to either our tomorrows at ku.edu or you're always welcome to reach out to me. I'm going to stop because the fun stuff is really coming up with the partner work. Thank you for inviting me and having me here.
Thank you, Jenny. That was a really informative and excellent foundation for this webinar to talk about the Our Tomorrows project and how and I think that sets a really good foundation then for the segue to talk more about how SenseMaker is being used to do some similar kind of work in other project settings. So with that, we will move to the team from YMCA of San Diego County, Lexi Palacio and Ariane Porras.
Hi, everyone. Welcome. It's nice to be here with all of you, and thank you for joining us. So I'm Lexi Palacio, Community Collaborative Director for the Partners in Prevention Initiative. I'll let Ariane introduce herself.
Yes, thank you, Lexi and Elliot. My name is Ariane Porras. I am a trainer and consultant with the Partners in Prevention Project at the YMCA in San Diego.
Thank you. Next slide, please. So in 2019, the YMCA of San Diego was awarded the Community Collaborations to Strengthen and Preserve Families grant from the Children's Bureau and Office of Administration and Children and Families. We named our project Partners in Prevention, and our project vision really is to cultivate a connected community that nurtures caring, strong, safe, and healthy families. We facilitate this project under the social service branch of the YMCA of San Diego County called YMCA Child Care Resource Service. Next slide, please. Our theory of change is that if we can increase protective factors and family well-being, we decrease the likelihood of child maltreatment. Some of the ways in which we do that within our project is by assessing family strengths and needs, really with an emphasis on strengths. So looking at what families might need, but also what do they really come with and already have that we can illuminate and highlight. We support in linking families to the supports that they want, when and how they want and need them. And then we really work at the systems level to improve coordination across some of our partner agencies that we work with. So San Diego is large and has a wealth of resources, and oftentimes connecting those resources can be a challenge. So we really come from the perspective of being the convener and supporter of connecting our social services branches together and partner organizations together to improve that coordination. We also have an emphasis on building adult capacity and agency capacity to increase family well-being. And we do that through trainings, oftentimes that are centered at supporting the families and children. All of this work is done in partnership with cross-sector partners, which include education, government, child welfare, social service providers, early care and education providers, health, and so many more. We can't do this work alone. We acknowledge and recognize that. We also focus on primary prevention and centering the child and family at the root of all that we do. Next slide, please. So this is just an overview of our values and principles. These are the key approaches in our relationships and our work, and were developed in collaboration with our partners. So our values and principles are that we do this work respectfully, in a strengths-based way, family-centered, trauma-informed, and culturally responsive. And our values are equity, so acknowledging and addressing historical and systemic inequities, impact, so catalyzing culturally appropriate, strengths-based, evidence-informed, and outcomes-driven efforts to increase child and family well-being. So inclusion, seeking to seek out diverse and honor those perspectives of those with lived experiences to inform our work and influence system change. Partnerships and collaboration. So as mentioned earlier, like we actively build trust with our community and our partners and can't do this work without them. And then accountability. So we work to align, leverage, and expand partnerships to achieve shared goals for children and family in San Diego. So really looking at what are others doing and how can we align not only our project work, but really what we want to do in San Diego to create a child and family well-being system. I'm going to hand it over to Ariane now, who's going to talk a little bit about why we've chosen to use Our Tomorrows and kind of the process that we went through in order to set this up. So thanks, Ariane.
Thank you, Lexi. So yes, really excited to share just how why we decided to use it and how we started to use it. So as Jenny so beautifully introduced the project, it really drew us. We were drawn in by the fact that we could listen, not just hear the community, right? And that we could spend some more time with the stories that are informing how they access services. So we really appreciated that Our Tomorrows captures an experience and not just a situation, right? We think that's stories are much richer in representation of an experience, and they're easier to relate to, and we can draw more patterns from that information that'll help us to better serve our families. So we just really appreciated how the stories provide a more accurate representation of how systems are meeting the needs for families or are not. And that sense making is done collectively, right? We like the partnership and the holistic approach to it, which is how, as a project, we've been trying to do the work from the start. So it really complemented those goals around equity that we had for the project, and we were just thrilled to try it out and see if it was what we hoped for. Next slide. So this is a bit of our timeline and how it started. September of 2021, we got the approval from the Children's Bureau to start using the framework. We started discussions with the project team, like Jenny, to start talking about the framework at our partner network meetings, which we hold every month. And after that, after we got some input, which we'll give a little bit more detail in the upcoming slides, we drafted a framework of what kind of questions and stories did we want to collect from our community here in San Diego. And then in February, we finalized that framework and started recruiting different partners to just do a small pilot before we did a full launch. Next slide. So in those partner network meetings, we had the discussions about the framework, and we wanted it to be co-developed with the partners that convene every month. Again, these are partners from our community, so we want them to inform and want everyone's voice represented on what do you want to know, what do you want to hear from in our community. And so the goal that we set was to ensure dignity of everyone accessing services, including sensitivity and inclusion of different cultures and trauma histories, and easier access of services overall, in order to support a culture shift from mandated reporting to mandated supporting. Our project is doing a lot of work around that effort and supporting our local child welfare in that work. And so we thought this is a great tool to help us gather more information to then start doing that work in a way that is resonant with what our community says it needs and wants. And so these were the questions that we started asking of our partners in order to put the framework together. What do we need to know that we don't know already, right? What does story collection look like for you? And if we get this right, which we're hoping, how will people's experience change? So with those goals in mind is how we created this framework, which we'll show you in the next slide. I gathered some images of just the Miro board that we used to do this activity in our partner network meetings. We put those questions up on boards and had everyone answer, and then we pulled themes from what we heard in those partner network meetings. So from that Miro board, we met with Jenny consistently and created the framework, which is on the next couple slides. Next slide. So this was the initial story prompt for our framework. A friend or family is thinking about moving into your community with their kids. They've asked you to share a personal story that would give them a good idea of what it's like to raise kids here. And so we had, again, our partners pilot that framework with the people that they were working with, and I'll give you some information on that, but that was the general introduction to the framework. Next slide. And these were some of the follow-up questions. As Jenny showed in the previous slides in her introduction, this is what it looked like for our participants to answer the question. So we really liked that it was more interactive. It was, share your story, but also here are the different ways that you can kind of gauge what that experience was like through these different questions. So if you showed you the triangle, the bar was a range that you can move around, and then this blue one on the right had the yellow squares that you can move in to kind of also show a range of how that resonates for the participant, the community member. Next slide. So from that, once the framework was created in February, we finalized that. We launched the pilot in March of this year. Again, we met with different partners in our network who were doing home visiting services already, and we were partnered with PWS, our local child welfare office. We launched officially that pilot in April and June. We did a debrief of the pilot in August, and we're doing the sense making actually this week. So we'll be able to get some information on that. Next slide. This is how we structured our pilot. We, again, partnered with our home visiting programs that we had been in communication with, and with the quality assurance staff that do visitation as well through our child welfare office here. The story collector training, Jenny and us, we partnered together, and so she provided the overall framework, and then we made sure to add a trauma-informed lens to how we wanted them to approach this work as well, since that is very important to us, and that's what we provide capacity building on in general for our project. From there, we held weekly TA meetings where the story collectors could drop in and ask questions, check in, basically sort through any hiccups that might be coming up. We recorded those meetings for those who couldn't attend. We just tried to make the support really available and accessible for them. We created a share drive. I would email a summary of the highlights in the discussion for that meeting and a link to the recording and a link to the share drive. So they always have the resources available to them if they needed to link back. We didn't have too many hiccups, thankfully, during the pilot, but we did have some lessons learned. Next slide. And that's what we want, right? We want a pilot so that we can work out some glitches. So our takeaways were we were really grateful for the commitment that our partners have to do this task. It really is group effort, and I think we just really appreciated that at several points throughout our project in the last few years. We really recognized the slowing down to ensure that language was clear and appropriate. We had it translated to Spanish, and so we made sure to sort through the language to make sure it was approachable and clear. We made sure to note that translation needs need to be accounted for from the get-go, be a little bit more proactive about that, and think about accessibility when it came to technology. So if the family didn't have a laptop or a tablet, could they use a phone? Would the framework come up appropriately through that method? And did our partners have the technology to assist when that was an issue for the family that wanted to share their story? We have been making huge efforts to make sure that if we're asking for a community member's time, that we compensate. And so we took the pilot as an opportunity to test some of those pathways towards compensation, and we had a few hiccups, had some challenges. It's harder to give out money than we realized, but we learned a lot about what is possible and what is not. So that was really helpful. And then of course there were just a couple bug fixes that we needed to address. But again, overall the pilot was not didn't have a lot of barriers, and we were able to have that nice experience of a soft launch before we plan a little bit to a bigger scale. Next slide. So with all those lessons learned and all that context that we were able to have, we're planning a full launch this fall of this year, and hoping to have the sense making session in early winter of next year. Next slide. And that's it for us. Thank you so much for listening. Hand it over to the next team.
Thank you, Alexi and Ariane. That was so helpful to learn about how you've been piloting SenseMaker in the context of your Partners in Prevention project. You had mentioned this, this group of discretionary grantees, community collaborations to strengthen and preserve families. And our next project team from Washington State is also implementing a discretionary grant project in this same group of federal child welfare discretionary grantees. They're strengthening families locally project. So with that, I'll hand it over to Aaron and Joy to talk a little bit about this discretionary grant project and the work and the ways in which they're using SenseMaker in the context of that project.
Thank you, Elliot. Hello, everybody, and thanks for having us here today. My name is Erin Havig. I use she, her pronouns, and I'm coming to you from the Cowlitz tribal lands in Washington State. Joy, do you want to do a brief introduction?
Yeah, sure. Thank you, Erin, and thanks everybody for having us. My name's Joy Lyle. I use she and they pronouns, and I come to you from the Nisqually tribal lands in Washington State near Olympia.
Thank you. We're very excited to share with you today about our project. We call this project Strengthen Families Locally. This project is housed within Washington State's Department of Children, Youth, and Families, which is a combined agency that highlights our early learning, child welfare, and juvenile rehabilitation services in Washington State. It's a altogether one agency, and that happened in about 2018. So we're still learning a lot about how to work together and how to support families. And I feel like this project gives us a lot of hope and ambition in ways that we can do this differently. If we can go to the next slide, please. So what you see on this slide we refer to as our pinwheel. So this is our goals and objectives of what we want to accomplish in this project. We want to reduce the rates of child maltreatment, reduce the rates of foster care entry, eliminate those racial disproportionalities that we see in our data systems in both maltreatment and foster care entry. We want to increase community resilience and then develop a replicable community-driven prevention model. A big piece of this for us was, as our agency came together into this new format, how do we move into a way that we can interact with communities in the way that's the most appropriate for the communities in the way they want to. So we're looking at learning from and with communities. So this project, we partner with different community organizations, different government, both state and local government, tribes, schools, families, and with that, it's families from the community neighborhood, as well as families with lived experience in child welfare, volunteers and other communities, community members, those resource people that really care about their community and want to make a difference. And as Elliot alluded to before, this project is funded by the Administration for Children and Families and part of the Community Collaborations Grantee Group. And we started this in 2019. We can go to the next slide, please. So with the funding that we have available, we knew we were not going to be able to serve the entire state with this project. And so we designed a sample of how we could pilot this effort within our state. So our community, or our state, creates these risk and protective factor profiles that one of the things that it details is the child welfare intake rate. And so our research team divided that out into quintiles, and then from the top quintile of those community locales, and a locale is about the same size as a school district, we randomly selected 4 communities from that upper quintile to be able to partner with. And so that is, so if you go left to right, we have Port Angeles and Sequim, which is the 2 larger counties that are highlighted there. In the dark blue, this teeny tiny one right next to it is Bremerton School District, which is in Kitsap County. The largest dark blue area that encompasses many, many different zip codes is our Stevens and Ferry counties. Both of those counties combined to get to 20,000 people. It's a very rural area. And this other tiny blue on the far right-hand side is a school district in downtown Spokane, which is a more urban setting. So we're distributed into many different areas. And one of the things that we knew in entering into this work is that each of these communities, although they had high child welfare intake rates, they had so many strengths, and each community was going to look different. And so we wanted to learn from the communities, what are your strengths? How do we use those strengths to address the child welfare intake rate and learn about what we could do together, while also balancing the racial equity piece of this, of the systemic inequalities that have previously existed and continue to exist, and how do we do something different to try to address those. You can go to the next slide, please. So why SenseMaker in our tomorrows? Even before we had this grant, I wanted to find a way to do this work. So I come from more of an implementation direct service experience. And one of the things that I often find is when you're looking at data and reports that come out, they're on like an annual basis. It's not tapped into the real-time needs of families and community. And families and community change much more rapidly than the state analysis roll-up, that report that we get happens. And so being able to dive in and capture those unique stories and experiences that were in our communities, what are those strengths that we see that families are sharing? How do we build more of that? And then what are those opportunities of where families are expressing needs or their real life experience that we can better learn from, that maybe gets dulled by a combined report that gets rolled up at the end. So from an implementation perspective, it's really about how do we listen to and have an avenue that really recognizes and supports having those stories and learn from them. We also wanted to design better interventions that address those changing needs. One of the things we saw throughout this implementation time is that everything changed. So in our communities, from the start of our first steps of implementing the project was right around that same time that COVID was rolling around, and it changed the approach that we had for everything. And so being able to adapt to those changing family needs and design with that intentionality in mind. And then wanting to really get a deeper understanding of families' experiences. As I mentioned at the beginning, our agency moved from 3 separate agencies into 1 combined agency. And for our team, that meant moving from being part of an early learning system to being combined with our child welfare and JR partners. And while we had done prevention work, we hadn't done child welfare work. And it's a different relationship with community members and with families, and the trust level is different. And we weren't having access to the same types of stories and meaning for all of the ways that people wanted to communicate and share. And this gives us a method to be able to capture what are those things that are most important to you, and how do we want to address those as we move forward? How do we want to design better services and supports and listen in a respectful and thoughtful way? Next slide.
Okay, so I'm going to take the wheel and talk a little bit about our implementation in this project. And I'm going to share a couple things that aren't on the slides, so bear with me too. So this is an example of kind of how we outreached about the project initially, and continued to just kind of short and sweet messaging, letting people know that this is a quick and easy way to engage, and that it is something that can help them and help their community. And then we have a link, and we have even a QR code that Jenny and her team were able to share. But we also found, as we were going through this and understanding our communities better, that this wasn't necessarily enough to get people to thoroughly engage. And so we kind of shifted course and decided that what we could do was to offer some additional funds to story collectors to help them collect those stories and honor their time and the effort that it takes to really sit down with someone and kind of build that relational rapport in collecting a story. So what we ended up with was a statewide call. So it's not focused on just on those communities where we that Erin showed you, but we have a targeted rate of story collection for those communities. So for everyone in the state, we were offering $25 per story, up to 200 collected stories. For folks in those specific communities, we were offering $50 per story, and then also an additional targeted rate for any stories coming from families who identified as either Black or African American or Indigenous or Native American, because those are the communities that are overrepresented in child welfare. So we want to overrepresent them in story collection. A lot of those community correspondents were from those communities, and then a lot of them also passed on some of the funds that they were getting to the folks that they were collecting from, which we didn't require because we couldn't really make that a requirement from our end, but we really strongly encouraged it. And the folks that were engaged as basically volunteers, stipended volunteers in this project really went above and beyond in story collection. So I think we can go to the next slide. And this is, so we actually, I just checked back. We have 660 stories now because folks our community correspondents are actually in their last month right now of funding. And so they're kind of really hitting the ground and getting stories in there. Those are not all for the Strengthen Families Locally project. We estimate about half are from those target locales, but they are really strongly overrepresented in the voices that we need to hear most, which is an important part of this. So I just went through and checked the numbers. So sorry, this isn't on the slide, but I was interested to see, so of those stories, we have 30% of them are from Black and African American families, or folks who identify as Black or African American. 5% are from Native American or Indigenous folks, and 30% are from white folks, which means the remainder are kind of a mix of, we have multiracial as an identifier. We also have Caribbean, Asian, Pacific Islander, several other identifiers. So we have really that targeted rate of collection was really able to bring in stories that are underrepresented in our system and that we are not hearing enough of, and those voices that we need to hear more of in this. And yeah, the slow start piece was just, we got the community correspondents kind of onboarded and ramped up in February. And since then, our numbers of stories have kind of really taken off. We were hovering around like 70 before that. So yeah, next slide, please. So this word cloud comes from the Our Tomorrows dashboard. You can actually go in and take all of the stories that have been recorded so far, and this is the word cloud that comes out of it. And I like it because I think it just tells the story of what people are thinking about. And of course, we're going to use SenseMaker to dig down into those stories. Our aim is to have at least one sense-making event this fall. It's been slow, as everything in this project is, to get there. So we're going to do sense-making, like a statewide sense-making session, and then each of those communities are going to get a sense-making session as long as we have enough stories from those communities to do that. And then we're hoping those local sessions generate more enthusiasm and bring more people into story collection and make people kind of start to want to snowball it without that added incentive. And then I'm gonna let Erin talk a little bit more about the future directions as well in terms of using sense making for other funding decisions in our agency.
Sure. So one of the things with the SenseMaker is we do have those stories. We have some in those locales, and what we're hoping to get to is 100 stories in each locale, so we can do a locale specific sense making session with them. But since we have now over 600 stories, and by slow start, one of the things that I was reflecting on is like we had a few months there, like October to February, where it was like 73 stories, 75 stories, 77, and now we're making these much bigger jumps. And we're hoping that those turn into iterative processes. But at the state level, our team manages home visiting funding, so the MCV, and we have a home visiting service account in our state. Our team also manages our community-based child abuse prevention dollars, which is CBCAP, and our children's trust fund dollars. So being able to look across these different funding buckets of what could we learn about what families are saying and needing, and how do we want to support that as we move forward. So wanting to use that in our funding opportunity design process, and helping our parents be able to walk through these sense making sessions and stories to be able to highlight what do we want to do. And then Jenny and her team at KU have been phenomenal to work with. So very patient with all of our questions, and we get into these ideas and brainstorming sessions. But one of the things that we've talked about is with our, when we do have our sense making sessions with community members, also having a funding opportunity available, so that ideas that people have that come out of that sense making session could turn into projects right away. So being able to apply for like $500 or $1,000 to be able to start an idea towards something that you learn from a sense making session. And as part of that, collecting more stories. So we want to see this continue to grow, to generate enthusiasm for our community members to really see this as an opportunity to provide their own story, their own interpretation of what these stories mean to them, and then participate in those action steps moving forward. Was there any other pieces, Joy, that I missed? And then if we go to the next slide, this has our contact information. So our email addresses are on here. And then every week on Friday, Joy creates a newsletter that goes out. And this newsletter has all the updates about what's going on with the projects and relationships in our community. And anyone's welcome to sign up to receive that if you're interested in weekly updates about this project.
Erin and Joy, thank you so much for that presentation. We're running a little behind, so I think we are going to go ahead and set it up for Kayla, for Dr. Byers. So, okay, so thank you. I see we've pulled up her slides separately. So Kayla, I think we're ready.
All right.
Thank you so much.
Good afternoon, and thanks so much for being here with us today. My name is Kayla Byers, and I'm from the University of Kansas School of Social Welfare, and I'm here to talk about our implementation of Our Tomorrows and SenseMaker within the context of a couple of the research projects that we have happening in Kansas, and provide a couple of different examples of what this can look like and how these different use cases of SenseMaker have enhanced our work. Next slide. So specifically within our school, the School of Social Welfare, we have a number of projects that are ongoing and share a similar vision. And that's that we're working across the state in multiple ways to develop a system of community and family well-being that's characterized by a really robust service array that's driven by and meets the needs and the priorities of families within the communities, so that we're able to ensure that they thrive within their communities without that need for formal interaction with the child welfare system. So within this overarching vision, we have multiple goals that we're using Our Tomorrows framework to address. Our first goal is to understand the needs of the community from the voices of community members themselves in order to ensure that the service array is well aligned to those needs. And then second, we needed a mechanism for measuring community level perceptions and values and changes in those values over time. And we found that this was able to meet both of those needs for us. So those goals led to two unique applications, I think, of Our Tomorrows in our work. And I'll briefly touch on both of these to provide a sense of both the flexibility and the applicability of this method. Next slide. So first, we used Our Tomorrows to inform our Family First implementation in Kansas. Elliot mentioned earlier, I'm the lead evaluator there. And so as part of that work, we really wanted to integrate voices of the community. So the Family First Prevention Services Act was, as you probably know, signed in 2018 and was intended to increase the availability and the accessibility of community-based prevention services to reduce the kids coming into care. As part of the planning for implementation in our state, our Department for Children and Families held a series of listening sessions to gather that input from providers and community members across the state about what is needed, what was already existing, and what they needed to see in terms of prevention services. So that was really successful, and we really wanted both us as evaluators and in partnership with the state wanted to continue this feedback loop as part of our implementation. So we introduced Our Tomorrows as a pathway for collecting that additional information about the current service array and the additional needs that may be present in any given community by sort of looking at the experiences of families. So to do this, we leveraged the some cross-sectional regional advisory boards that we support across the state. That includes providers from the Family First implementation agencies, as well as others, community members, leaders in communities, et cetera, to help collect additional stories from the families that they were serving. We wanted to have a really wide range of stories and that encompass not just the child welfare population, but also, just the community to understand families as a whole in our state. And our goal with this application were to mine those stories, to understand family needs and gaps in the service array, to support identification of any local solutions to those gaps that are workable from the perspective of the members of the community and not just from our perspective as evaluators and implementers. And then also to evaluate any structural barriers that emerge from the stories that are related to these different needs and bring those to our state level partners and advisory boards. Next slide. So this slide shows the process that we followed in this work. So first we were able to leverage the story bank that Jenny mentioned earlier, where the data was already collected and underway by the Our Tomorrows team. And these data were collected using a story prompt to talk about a time when the family was thriving or merely surviving. So again, a really broad prompt that gives them an opportunity to tell a story about their experiences. Then we provided region-specific links, the QR codes that were shown earlier. We provided those to each of our regional groups and to members of the committees and asked them to help supplement the story bank, to help with data collection within their individual regions to make sure that we had really robust representation of the families that they serve, to share that within their own networks, to add stories themselves to help us really realize this effort. And then our goal was once regions collected enough individual stories for their geographic area, we would hold a regional sense-making session. Within those sessions, identify those small safe to fail solutions that the Washington group just mentioned and address those needs that emerged. And like they mentioned, an incentive for this work, the Our Tomorrows team at the Center for Public Partnerships and Research did make small grants available to the groups to fund those solutions. So for example, one of our regions identified a need of family members re-entering the community after being incarcerated, and that there were child welfare requirements, job search requirements, other things that these folks were really unable to proactively do. And so the solution they identified was purchasing a computer for a jail in the community, specifically for meeting those requirements, so that somebody getting ready to reintegrate in the community, to try to reconnect with their family, could meet all of those needs really proactively from where they were. So that's just one example of sort of one of these action lab results that came from just one region in our state. So, and then any issues that they couldn't resolve through this process were elevated to other groups and individuals who might be able to address those barriers and realize that robust service array for children and families. So This included our statewide interagency and community advisory board, which includes statewide leaders, policymakers, administrators, DCF partners, anything that at the local level seemed a structural or systemic issue that didn't have a hyper-local solution. We elevated to those groups to address so that they could understand what's happening at the local level. Much like the Washington group talked about, we did run into some challenges with this. You know, the incentive to collect these stories, while they were very excited about these data, this is an additional ask. So the citizen journalists and paying folks for collecting the stories, I think, is really critically important in order to support that effort. That was something that we took away from that effort. Next slide. Our second application of SenseMaker is also taking place within the context of a primary prevention initiative. However, the why and the how of what we're doing are slightly different in this case. And this initiative, our project is called the Universal Prevention for Strong and Thriving Families Initiative, or Family Strong, which is a project not from the Community Collaborations Cluster as the other groups are, but from the Family Support for Primary Prevention Children's Bureau grant cluster. And through this work, we're seeking to normalize asking for help within a family-centered and interconnected community service system in an 8-county region in Southeast Kansas. And the goals of this project are to create and demonstrate this integrated cross-sector network of services and supports in the community to address social determinants of health, to create the necessary system and service infrastructure that's needed to promote primary prevention in the community while reducing racial and ethnic inequalities in the system, and to establish a shared community value of universal well-being for children and families that's achieved through universal supports. Next slide. To achieve these goals, we're applying SenseMaker in 2 different ways. So our first approach aligns with our federal planning year, which we're just wrapping up. We used existing story data from the story bank that exists in Kansas about surviving or thriving to hold sense-making sessions with members of our Family Strong Steering Committee. And we did 2 of these sessions, one primarily with professionals on our steering committee, because at the time that was who made up our steering committee primarily. And then a second one with a large group of members of our steering committee with lived expertise who we've since added, as well as their guests and friends. These sessions were facilitated by Jenny's team in our Tomorrows at CPPR. And the goal of these sessions included establishing a baseline of family experiences and needs in Kansas. This was about, you know, establishing and validating our implementation plan during our planning year. So we were looking to challenge any assumptions about what families needed or wanted, make sure that what we had designed really was aligned that our strategies met those needs, goals, and priorities of the community, that we weren't laying something on top of the community that wasn't community driven. So with that said, our goal really is, in our overall approach, is to work with the community, not on or for the community. And so we really felt like SenseMaker and Our Tomorrows was a perfect fit for us to be able to do that. So with using this approach, we were able to really meaningfully integrate those community experiences in our planning through the use of these qualitative stories, and then engage in a co-design process with the professionals and the community members from the target region on our steering committee and in these sessions. And the results from these sessions were used to refine our planned initiatives and our root cause analysis during the planning year to set that strong foundation for implementation going forward. Next slide. So now that we've conducted our planning year and are concluding that, we'll move into our second use of SenseMaker in this project. And in this approach, sense-making is used as a measure of community level outcomes, both in terms of process and impact. So as part of Family Strong, we will continue with data collection, but using new primary data. We'll be using the prevention framework developed by our friends in San Diego and Our Tomorrows. So we're excited to get an opportunity to try that out. And then we'll hold semi-annual sense-making sessions across the region. And that really has 2 goals in mind with that activity. So first, we'll be assessing the community level perceptions of help seeking and stigma related to seeking supports for children and families. We want to understand how this value at the community level changes over time. And we anticipate that through these stories and the community-based co-interpretation that happens during sense making, we'll be able to identify and assess that change. Second, we'll continue to use these sense-making sessions as a process study activity to ensure that Family Strong strategies continue to be aligned with the community needs, and we'll adjust our implementation as needed based on what we learn from these sense-making sessions. Next slide. So that's a little bit of an overview of where we've been and how we're planning to use SenseMaker. I wanted to give you just a little bit of a taste of the kind of information that we're able to glean through sense making in our planning period. So this is the first use case for Family Strong that I discussed. This was our planning period. And this really informed our root cause analysis. And through this, we learned that families in our region experience complex adversity across many domains and lack the community-based primary prevention services necessary to mitigate those challenging circumstances before they rise to the level of a crisis that could necessitate child welfare involvement. Second, we learned that the cross-sector service array of primary prevention supports and services in our region are fragmented, siloed, and don't have really comprehensive coordination to make them really accessible for families. We also learned that the characteristics of the region are not really well aligned with place-based services and a service delivery approach, that we may need to come to families and meet them where they are. And that the historical experiences of families accessing the service array, the punishment, negative consequences, lack of actual help, result in fear and stigma related to accessing community-based support services. So these are some of our lessons learned through our root cause analysis and our planning and sense making. If we go to the next slide, you can see some of the key insights that we were able to kind of probe further in these sense making with our lived expertise members of our steering committee to understand the unique regional context, how these root causes manifest in our region. And then this leads us to some key questions for our implementation that we'll address to really improve the system. So we learned that sometimes asking for help isn't explicit, and that means that families sometimes don't feel heard. So we need to ask ourselves in our implementation, how can Family Strong help communities better recognize when people are looking for help, but not saying it in the way that we expect to hear it? We also learned that people feel secure when they have the support of those around them. So our task is to examine what parts of Family Strong can help strengthen support in communities, and what do we need to do to make it stronger. We also heard that sometimes people don't know what kind of help they need. So part of our job through this work will be to help people know where to look. And then finally, COVID showed us that everyone needs help sometimes. And so we'll take this information and work to further universalize help seeking through our work. Next slide. And I'm gonna end on this slide just in the interest of time, so we have time for questions. But I wanted to just share, some of the concepts that were drawn out from people with lived expertise as a result of this, specific to the contextual setting of the region. You can see some of the things that came up, that COVID did normalize help seeking for people, making it evident that we do all need help, and that isn't shameful. Participants discussed the danger and the frequency of re-traumatization when they do seek help from a broken, fragmented system. They also described the region as an opportunity desert with toxic independence as something that we need to overcome in terms of help seeking. So this approach allowed us to work with people with lived expertise in order to make sure that our program development is well aligned and driven by the community. So there are a couple more slides in this deck that kind of show how this all comes together and what our feedback loop is, along with our contact information and some information about who our partners are. But I will just stop there and turn it back to Elliot. Thanks.
Thank you, Kayla, and thanks again to all of our panelists for sharing all these insights and lessons learned for how you're applying SenseMaker in the context of your projects. We are running a little over, but we still do have a few minutes for Q&A. Before I address it, I do see that we've received several questions in the Q&A feature, and some of the panelists have already responded in writing to some of them, but I think they might be worth discussing as part of the broader group. But before we do that, I just wanted to check in with the panelists to see if anybody had any follow-up questions or comments or observations for other panelists, or just more generally. Well, oh, okay, Lexi, or no? Okay.
I think I'll just share, I'm just appreciating in each one of our dialogues that we've been having and presentations that we've been having, the emphasis that we have on really making sure that the information comes from the community and that it's really respectful and from a place of learning and understanding and openness. And so I just see that parallel across kind of all that we're doing.
Thanks, Lexi, for that observation. Well, in our remaining time, let me just mention some of the questions that we've received in the Q&A. One of them was about how SenseMaker might inform the CFSR process. The question was, can the learnings from improvement opportunities based on insights shared from community members through SenseMaker inform the CFSR process? And Erin, I see that you already addressed that this is something that you haven't explored, how SenseMaker could inform CFSR, but it's something that you would be interested in. So I was just wondering if any of the other panelists have thoughts about how insights and lessons learned from SenseMaker could inform your state's CFSR processes. You know, I'm thinking, Kayla, about like what you learned through this about issues around service fragmentation, areas where there are gaps in the service continuum for families who might be involved in the child welfare system, and how this information might help address some of those, and what impact that could have on CFSR outcomes down the road. But any comments or observations from the panel about the relationship between something like this as a tool to inform the CFSR process?
I would say that there definitely is a connection there for us, in that we are gearing up for CFSR right now and are participating in our statewide core team. And so we're able to bring these learnings directly to those groups and to share the qualitative findings from the stories from the community and make sure that those are at the table. So that is one way that we are doing that.
Thank you. Any other comments from other panelists about SenseMaker and its relevance to CFSR? Well, we had another question about confidentiality concerns of individuals or groups, and whether that's a barrier in using a tool like SenseMaker. And Erin and Jenny, I see that you've already addressed those in writing. Safeguards that are in place to ensure the confidentiality and privacy of information that's shared. Jenny, I see you talked about, you have these, safeguards in place with the software. It's password protected, and there's managed access. So there are these safeguards to ensure privacy and limited access. But any other follow-up comments about that, about addressing confidentiality concerns with sharing stories from other panelists or from Jenny or Erin?
One of the things that I'll just add in there is that when you click on the link to share a story, you provide a consent that your story can be used. And then you enter your story and you answer the questions on the triads. And then you authorize again to submit your story. And I think that this feature is really handy because sometimes there's a therapeutic process of just getting it out there and you're like, oh, I don't actually want to share that. And so you still have the option to not submit that story after you've typed it all out, if that's something that you choose. And I just wanted to highlight that in there as well.
Thanks, Erin.
Yeah, and I would just add, so I've been working with this project for about 5 years now. And when I started, and certainly still, but early on, I remember being incredibly cagey and tight with control around access to the data and to the stories for this reason. And over the years, what we've really learned is that having gone through the consenting process and gotten to the end and really clicked that final submit button, people really, they're going to do it. If they're going to share it with you, they want you to do something with it. They want you to use it. And so it's that's not to say we're not careful with the data at all, but that is just something that I hold really dear when we are doing this work and have learned over the years. I mean, people don't do this unless they actually believe that you will do good with it. So.
Thanks, Jenny. We had another comment, another question about the issue of compensation for both story collectors and storytellers and how that's handled. And I know with the community collaborations grantees, we've had this conversation recently about this issue of compensating families and individuals with lived experience in the child welfare system. So it's definitely relevant to that. You know, the question here was whether there are stipends that are provided for story collectors and or storytellers. And Aaron, I see that you responded that you do provide a stipend to story collectors, and then many of those story collectors provide an incentive to storytellers to provide a story such as a money or gift card or other resource. Just wondering if any other panelists have thoughts or insights on how they address that issue of compensating people who share their stories, in addition to the people who collect the stories.
Yeah, I can share. So when we first were piloting this, we did ask our partner organizations who participated in the pilot about how we may compensate the story collectors, but they were not interested in us, compensating their staff. And so we did a lot of appreciation for the staff who were collecting the stories, but actually did not compensate them. We did compensate and will continue to compensate the storytellers. And the way that worked for us is that we were able to embed a Qualtrics link at the end of the Our Tomorrows survey. So once the person completed the survey, they clicked on the link and it took them to a different site through the YMCA. So it was not attached to their story, which was really important to us. Folks understood that there was confidentiality around that. They would fill out their information, so name, email, and then we would be able to route them an e-gift card for $25. And so on our end, we feel like that was really helpful, that people could get access to that. And we did hear from the story collectors that was really a positive outcome, that people felt like we were honoring their expertise in their story.
Thanks, Lexi. That's just such a great example of how you're leveraging technology to compensate people in some direct way, some immediate way, some meaningful way. So I think that's such a great example. Any other comments on that, on the issue of compensation for story collectors or tellers? Well, we are a little over time. We had one last question that I thought it would be interesting to hear from the panelists from. One of the question was, what are the requirements to be a story collector? And I'm just curious to hear, and I see, Aaron, you did comment on the group of story collectors who you identified and expressed interest in that. But I'm just curious to hear from the panelists, like when you think about, people who are collecting these stories, like what makes for a good story collector? What are the kind of characteristics or talents or skills somebody needs to bring to the table to be an effective story collector? Thoughts from the panel?
I think I'll just share our experience again with the pilot. One of our story collectors described it as chicken soup for the soul. So I don't know if you remember those books, but really,
yes.
I think that one of the driver was the person collecting the story really had a passion and really understood what we were then going to do with that information. And so for us, it felt like making sure the story collectors understand that this information is going to go somewhere and that we're going to do something about it was really important. So I would really just say probably like being able to provide that context for story collectors and that passion behind that. Many of our story collectors also completed their own stories. We all have our own stories, and we've all entered this work for lots of reasons, and our stories are important too. And so I think that it for me, it just feels like that passion was there for our story collectors, and that was a good driver to kind of motivate people to collect stories.
Thanks,
I will.
Lexi. Yes, please, Jenny.
Oh,
Yes.
sorry,
Yeah,
Elliot.
yeah,
I will
please.
just add, we kind of have a at this point, I think, well-known story collector in our state of Kansas, a young teenager who a few years back was a story collector himself, and he was very passionate about making sure that his rural community was represented in the story bank. And there have been newspaper articles written about him and his efforts to do that. He sort of famously would go flag down farm staff and folks on tractors and help them get their stories. And so I think just it's people, it's everyone. It's people who are really passionate about who they are and their community of people and where they come from, and wanting those voices to be heard. So I would say anyone can be a story collector.
Thanks, Jenny. Well, we are a little over time, but just wanted to see if we had final questions for the panelists. Any other questions that participants would like to share, or just general observations about today's session that you'd like to share? Any final comments from the panel before we wrap up for today?
This is Erin. I would just add that I'm so grateful. I'm so grateful to the folks at KU for this opportunity to participate in the Art Tomorrows. They've built a beautiful tool. I'm excited to learn from the other sites, and also so very grateful to the Administration of Children and Families for the opportunity to have funding to do this work and to really engage with communities.
Thank you, Erin. And Lexi, I think you wanted to say something.
Erin said it, so I was
Yes,
just,
okay.
I'm just going to comment on, I think if you, a big takeaway is just the flexibility that we've been given, both in the grant and with the support of University of Kansas, to kind of make a prevention framework that's going to work for San Diego. And I'm appreciating that as well. So thanks, Erin.
Thanks, Lexi. And let me say thank you again to all of our panelists today. This has been such an interesting, engaging discussion. I just think that this software tool is so exciting and innovative, and it's been just fascinating to hear about how you're applying it in the context of your projects in California, Washington State, and Kansas. Thank you all again to all of our participants for staying a little over today. Again, please look for some follow-up correspondence from JBA regarding the recording of today's webinar that will be made available. And thank you again for your participation, and have a wonderful day.
Everyone.
Thank you.